Imagine for a second a doctor looking at your chart and reading just a single ancient word that instantly changes your diagnosis from, a routine manageable infection to a 24-hour fight for your life.
Yeah, it's a terrifying thought.
Right. I mean, usually when we think of modern medicine, we picture this absolute precision, like engineering.
Right.
An MRI shows a jagged white line on a bone, and the doctor just points and says, "Yep, there it is. It's broken."
Exactly. You expect it to be binary.
But when you step into the world of medical terminology, like specifically the language we use to map the human nervous system, that precision starts to look, well, a lot more like an optical illusion.
Oh, absolutely.
Because you realize that the words dictating your care, they're often born from these bizarre historical accidents, ancient metaphors, and honestly literal mistranslations.
So, welcome to the deep dive. Today we have a really fascinating stack of sources focusing on two specific medical roots.
Right, myelo and meningo. Yes. Our mission today is to navigate the spinal cord and its protective membranes. We want to show you how understanding these ancient words gives you, it's basically an absolute superpower when you're reading a medical chart.
It really is a superpower.
Yeah.
Because, these aren't just sterile scientific labels.
Yeah?
They are historical artifacts.
Yeah.
They've been handed down from ancient Greece, passed through centuries of Islamic scholarship, medieval monasteries, and they carry the weight of incredible life-saving discoveries, but also massive and sometimes fatal misunderstandings.
Okay, so let's unpack this. Because whether you are a nursing student, a seasoned clinician, or just someone trying to decipher a loved one's radiology report, knowing these roots totally demystifies the human body. But right out of the gate, our sources highlight a massive trap with our first root, myelo.
Oh, the classic trap.
Right, because this root has two completely different, entirely legitimate meanings, and which one applies depends 100% on the context.
Yeah, the root myelo comes from the ancient Greek word myelos. But to the Greeks, myelos didn't actually mean one specific anatomical structure.
Wait, really?
Yeah, it essentially meant marrow, or frankly just any soft, squishy substance that filled a biological cavity.
Okay, which sounds harmless enough, I guess, until you look at how modern medicine applies it today. Because today, myelo can refer to the spinal cord, the massive neural highway running down your back, or it can refer to bone marrow.
Right, the soft tissue inside your bones that basically acts as a blood cell factory.
Exactly. And from a biological standpoint, those two things have absolutely nothing to do with each other.
Nothing at all.
It's like using the exact same word to describe the highly sensitive copper wiring inside your walls and the pink fiberglass insulation keeping your house warm.
That is a perfect analogy, actually.
So if this is causing real-world clinical headaches, why on earth is the medical establishment so stubborn about fixing it? It seems kind of irresponsible to just leave that ambiguity in play,
Well, what's fascinating here is that the ambiguity is entirely baked into the history, and medical culture is incredibly resistant to altering its foundational language.
I can imagine.
Right, so think about the early anatomists. They were dissecting without the aid of microscopes. So to them, the spinal cord genuinely looked like it was just a continuation of the bone marrow running up through the vertebrae.
Oh, wow. So they literally thought it was the same stuff.
Exactly. It was all just myelos. They had no technological lens to see that one was this complex bundle of motor and sensory nerves, and the other was, churning out red blood cells and platelets.
So the mistake just calcified into the language.
It's stuck. Today, if you are working in neurology, you see words like myelitis,
Right.
which is inflammation of the spinal cord.
Right.
Or you order a myelogram, which is an imaging study of the spinal cord.
Hmm.
But if you walk down the hall to the oncology wing, you suddenly have myeloma, a cancer of the bone marrow plasma cells.
Yeah.
Or myelogenous, meaning produced in the bone marrow, like in chronic myelogenous leukemia.
Hold on, though. Modern medical terminology educators must be pulling their hair out over this.
Oh, they absolutely are.
Because a term like myelogenous sits right next to myelopathy in a chart. And if a junior clinician is transcribing notes quickly, and, the surrounding context is thin, they could easily misread the intent. I actually read in the sources that some newer curricula advocate for adding adjectives, like forcing people to write spinal myelo versus marrow myelo.
They do advocate for it, yeah. But clinical practice on the ground is notoriously stubborn. The medical community at large essentially refuses to adopt the change.
Oh, of course they do.
Right. They just say, well, physicians learn the contextual clues during their residencies, and they just expect everyone else to keep up. So the ambiguity just remains a permanent fixture of the landscape.
Wow. And the stakes of interpreting that neural wiring correctly are astronomical, which brings us to this masterclass in how clinicians stack these roots together to build a diagnosis, poliomyelitis.
Oh, this is a great example.
Right, so if I look at the roots we just discussed, polio comes from the Greek for gray. Myelo, in this context, is the spinal cord, and icatis is inflammation. So this literally translates to inflammation of the gray spinal cord.
Exactly.
But how does that actually lead to the catastrophic paralysis we always associate with the disease?
Well, this is where the word perfectly describes the hidden biological mechanism. The gray matter of your spinal cord, specifically in an area called the anterior horn, is where your motor neurons live.
Okay, the motor neurons.
That's right. These are the cells that send the signals telling your voluntary muscles to move. And the poliovirus has a terrifying affinity for those specific gray matter cells. It infiltrates them, hijacks them to replicate, and ultimately destroys them.
So the wire gets cut at the source. Like the muscle itself might be perfectly healthy, but the signal from the gray matter just never arrives.
Precisely. The muscle atrophies because the spinal cord's gray matter is inflamed and dying. 14 letters, and you have the entire diagnostic mechanism right there.
That's incredible.
And you're right about the stakes. I mean, in the peak United States epidemic year, which was 1952, roughly 58,000 cases were reported, over 3,000 deaths, and more than 21,000 people were left with some degree of paralysis.
Which leads directly into a really famous historical failure connected to this exact word, the 1955 Cutter incident. Because, the rush to prevent poliomyelitis led to one of the darkest chapters in pharmaceutical history.
Yes. In 1955, the Salk polio vaccine was finally approved. It was a killed virus vaccine, meaning the virus was supposed to be inactivated with formaldehyde so it couldn't cause disease, but it would still, trigger an immune response.
Right.
Cutter Laboratories was one of the manufacturers licensed to produce it, but their inactivation process failed biologically.
Wait, how does a major pharmaceutical company just fail to kill a virus? Like, were they cutting corners?
It wasn't really cutting corners. It was actually a failure to understand the complex physical mechanics of the virus in suspension.
What do you mean?
Well, the poliovirus particles clumped together in the solution. So the formaldehyde effectively killed the virus particles on the outside of these clumps, but the live, virulent virus hidden in the center of the clumps survived.
Oh, no.
Yeah, it was a massive biological miscalculation.
And they injected this into children.
Roughly 200,000 children received the defective vaccine before they recalled it.
Wow.
It caused around 40,000 cases of abortive polio, 51 cases of permanent paralysis, and 5 deaths. All from a vaccine meant to prevent the very poliomyelitis the word describes.
That is just tragic.
It really is. And it fundamentally changed how the FDA regulates biological products.
Yeah.
Proving that understanding the mechanism, not just the outcome, is everything.
Absolutely. So the danger of misinterpreting the spinal cord, that myelo root, is incredibly high. But the stakes somehow get even higher when an infection breaches the cord's protective security system. So let's move from the cord itself to its coverings.
Okay, let's do it.
Because while myelo is this confusing trap, our second root, meningo, is brilliantly unambiguous. It comes from the Greek meninges, meaning membrane, and in modern usage, it always points specifically to the meninges.
Right, the 3 protective layers enveloping the brain and the spinal cord.
Exactly. So you have the tough outer layer, the dura mater, the web-like middle layer, the arachnoid mater, and the delicate inner layer, the pia mater, which hugs the neural tissue directly, supplying it with blood vessels.
Yeah, those are the 3.
Okay, stop right there, though, because you just said dura mater and pia mater. These are the official clinical Latin names for these membranes. They are printed in every modern medical textbook, but they literally translate to motherhood.
They do, yeah.
Dura mater means tough mother, and pia mater means tender or pious mother. How did we end up calling the membranes inside the human skull mother? Like, I just refuse to believe a rational scientist just looked at a brain covering and thought, ah, yes, a tough mother.
Well, you're absolutely right to be skeptical, because no single scientist invented this. It is the result of a massive, centuries-long game of telephone.
Really?
Yeah, it starts in Alexandria, Egypt, around 300 BCE, with a Greek physician named Herophilus of Chalcedon.
Ah, the father of anatomy. And Alexandria was the only place in the ancient world where human dissection wasn't massively taboo, right?
Exactly.
Right.
Under the Ptolemaic dynasty, Herophilus was actually allowed to dissect human cadavers, which allowed him to carefully document the membranous coverings of the brain. But he just called them membranes.
Okay, so no mothers yet.
No mothers yet. Then you fast forward 5 centuries to Galen of Pergamon in Rome. Now, human dissection was strictly outlawed again, so Galen was dissecting animals, mostly Barbary macaques and pigs.
Oh, wow. Just making assumptions about humans based on pigs.
Pretty much. But he expanded on Herophilus' work and distinguished 2 distinct meningeal layers, which he simply named the thick and thin membranes.
Okay, so far, so logical. Thick membrane, thin membrane. We are still firmly grounded in structural reality here. So where do the mothers actually come in?
The mothers entered during the medieval Arabic translation movement. So in the 9th and 10th centuries, these brilliantly sophisticated Islamic physicians, like those in the circle of Al-Razi, translated Galen's Greek texts into Arabic.
Right.
But they didn't just translate word for word. They interpreted the biology based on the prevailing theories of their time. So they used the Arabic phrase al-dima, which translates to mother of the brain.
But why? Like, why use a reproductive metaphor for a brain covering?
Because of a fundamental embryological misunderstanding. They observed the tough, protective nature of the meninges and incorrectly theorized that all the other membranes in the human body literally originated from or budded off from the meninges in the skull.
Oh, I see.
Yeah, just as children come from a mother, they believe the meninges birthed all other membranes. So it was this poetic, highly functional metaphor for the biological origin of tissue.
That is wildly creative. But how does an Arabic metaphor permanently fuse into the official Latin vocabulary of Western medicine?
Enter an 11th century monk named Constantine the African.
Okay.
He was a brilliant translator working at the monastery of Monte Cassino in Italy. He took these Arabic medical texts and translated them into Latin to be used in the first European medical schools. But instead of going back to Galen's original Greek terms for thick and thin...
Oh, no. Let me guess.
Yep. Constantine translated the Arabic mother absolutely literally into the Latin mitter.
That is amazing. So every neurosurgeon today is basically quoting medieval poetry.
Without even knowing it. I mean, think about it. When a modern anesthesiologist administers an epidural to a woman in labor, the word epidural literally means upon or outside the dura.
Oh, wow.
The needle places the medication in the space just outside the tough mother, the dura mater. They're applying a 21st century medical procedure to a medieval Arabic metaphor about childbirth.
That is just mind-blowing. But, okay, let's look at what happens when that tough mother fails to keep the outside world out. Let's talk about meningitis. Meningo plus itis. Inflammation of the meninges.
Right.
Every parent sending a kid off to live in a college dorm room knows to be absolutely terrified of this word.
Right.
But there is a massive misconception we really need to clear up here. Not all meningitis is an automatic death sentence, right?
Correct. The word itself only describes the location of the inflammation. It says absolutely nothing about the biological cause or the severity.
Okay.
Viral meningitis is by far the most common form. It's usually caused by enteroviruses. And I mean, it can make you feel completely miserable, but typically it resolves on its own without specific antiviral treatment.
But when we hear the horror stories, you know, the ones where a previously healthy young person dies within 24 hours of their first symptom, that's bacterial meningitis.
Yes, unfortunately.
Why is the bacterial version so uniquely lethal? Like, what is the actual mechanism killing the patient so fast?
It's a brutal, dual-pronged attack. When a bacteria like Neisseria meningitis breaches the meninges, it doesn't just sit there. It multiplies explosively in the cerebrospinal fluid.
Okay.
Your immune system detects this and mounts a massive inflammatory response. But remember, the brain is trapped inside a rigid, unforgiving bone box, your skull.
Right.
As the meninges inflame and swell, there is literally nowhere for that tissue to go.
So the intracranial pressure just spikes.
Exactly. The pressure literally crushes the brain tissue against the skull, specifically compressing the brainstem, which is what controls your basic life functions, like breathing and heart rate.
That is horrifying.
And that's only half the battle, because the bacteria are also shedding highly toxic outer membrane proteins called endotoxins directly into the bloodstream. This triggers profound septic shock.
Oh, man.
The blood vessels leak, blood pressure plummets, and organs fail. It is a catastrophic systemic collapse, which is why even with modern intravenous antibiotics, the fatality rate still sits around 10 to 15%.
Which perfectly explains why the MenACWY vaccine, the meningococcal conjugate vaccine, is strictly mandated for college students. I mean, when you put thousands of young adults in close quarters dormitories, sharing drinks and coughing on each other, you are creating the absolute perfect vector for for that specific bacteria.
Precisely. Historically, 19th and 20th century military barracks and boarding schools saw these explosive outbreaks for this exact reason. The environment just turbocharges the transmission.
That really shows the terrifying clinical weight of the meningo root. But what happens when our two roots, the cord and the covering, what happens when they crash into each other in a single diagnosis?
Yeah.
Let's look at spina bifida. What is the biological difference when you add that extra root to a diagnosis?
This is a perfect example of how precision in the root equals precision in understanding the defect. So spina bifida is a neural tube defect. During the very first month of pregnancy, the embryo's neural tube is supposed to zip shut, kind of like a jacket, to form the brain and spinal cord.
Right.
If it fails to zip completely, you get a defect.
So let's look at a meningocele. Meningo meaning membranes, plus cele meaning hernia or protrusion.
Right. Biologically, in a meningocele, the unzipped vertebrae leave a gap, and the meningeal membranes push out through that opening, forming a fluid-filled sac on the newborn's back.
Okay.
But, and this is crucial, the spinal cord itself remains relatively in its proper place inside the spinal canal. Generally, this carries a far better prognosis, often with little to no nerve damage.
But then you have a meningomyelocele. You literally just add myelo to the exact same word.
And the biological reality completely shifts. Meningo for membranes, myelo for the spinal cord, and cilia for protrusion.
Wow.
The word tells you instantly. Both the protective membranes and the spinal cord itself are protruding out of the baby's back into that sac. The nerves are exposed and highly susceptible to damage.
And according to the CDC data in our sources, that is actually the most severe and most common form of spina bifida, affecting roughly 1 in 2,700 live births in the U.S. Just dropping the myelo root completely changes the patient's lifelong reality.
If we connect this to the bigger picture, it highlights something incredibly important about medicine. Just because these words are ancient Greek and Latin doesn't mean our understanding of them is static.
Right.
Human technology constantly changes the clinical weight of these words.
The MRI revelation with meningiomas is such a powerful example of that. We're talking about tumors of the meningeal layers, specifically those web-like arachnoid cap cells.
Right. For most of the 20th century, the scientific consensus was that meningiomas were a relatively minor, infrequent category of brain tumor, especially compared to aggressive tumors inside the brain tissue itself, like gliomas.
Because before the 1980s, neurologists literally couldn't see them.
Exactly. The diagnostic tools of the era, like early CT scans or pneumoencephalography, often missed them entirely. Because many meningiomas are benign and extremely slow-growing, patients live their whole lives totally asymptomatic.
So they just never knew.
Right. The tumors were essentially invisible until an autopsy. But from the 1980s onward, the widespread adoption of MRI technology shifted the landscape overnight.
Because MRI uses magnetic fields and radio waves that are incredibly sensitive to soft tissue contrast.
Yes. Suddenly, these tiny, silent tumors lit up on scans across the country. Improved imaging revealed that meningiomas are actually the single most commonly diagnosed primary brain tumor in the United States today.
Really? They outnumber gliomas?
They absolutely outnumbered gliomas. The terminology didn't change at all, but the technological lens did. It fundamentally altered how often a clinician writes that word in a diagnostic report and how often a patient has to hear it.
Which brings up another huge misconception from our sources tied to one of the most famous names in medical history, Rudolf Virchow.
Ah, yes.
In 1854, Virchow coined the term myelin, and he is rightfully considered the founder of cellular pathology. But he accidentally created a massive point of confusion that still trips up biology students today.
He really did. People see the word myelin, they spot that myelo root, and because of everything they just learned about the spinal cord, they just assume myelin is a substance found exclusively in the spine.
Right, but Virchow didn't name it based on where it was located. He named it based on what it looked like through a rudimentary 1854 glass microscope. He went all the way back to the original ancient Greek meaning of mylos, a squishy marrow substance.
Yeah, he looked at this whitish, fatty sheath wrapping around the nerve fibers and thought, that looks like marrow.
So he just called it marrow-like?
Exactly. He had no idea what it actually did. But today, we know myelin is functionally the biological equivalent of the rubber casing wrapped around a copper electrical wire. It insulates the nerve fiber, allowing electrical impulses to travel rapidly and efficiently.
Wow.
And crucially, it wraps around nerve fibers everywhere, in the brain, in the spinal cord, and in the peripheral nerves.
Which is incredibly important to understand for a disease like multiple sclerosis. If I think about that rubber casing analogy, MS is essentially the body's own immune system attacking and eating away that rubber insulation.
That is exactly what demyelination is. And when that insulation is damaged, the electrical signals from the brain short-circuit before they reach the muscle, or they travel way too slowly,
Mm.
causing the varied symptoms of MS scrub, from vision loss to severe mobility issues.
That is devastating.
It is. MS affects an estimated 1 million people in the United States today. You simply cannot understand the system-wide impact of MS if you mistakenly think myelin only exists in the spinal cord. It is a brain and spine disease.
Which leads us to one last brilliant physiological myth to debunk. The misconception that meningo only refers to the coverings of the brain. Like, people think of a skull cap just stopping at the neck.
Oh, definitely not. It is a single, continuous system. The dura, arachnoid, and pia mater do not stop at the base of your skull. They envelop the brain and seamlessly extend all the way down through the vertebral canal without interruption.
Really? All the way down?
All the way. The cerebrospinal fluid that cushions your brain flows continuously down your spine. It is one enclosed, shock-absorbing pool.
And the practical application of that continuous system is amazing, because it's the entire biological rationale behind a lumbar puncture, a spinal tap.
Precisely. If a doctor suspects you have a brain infection, like encephalitis or meningitis, they don't need to drill into your skull to test the fluid.
Thank goodness for that.
Right, because the membrane space is completely continuous. They can safely tap the spine and your lower back, draw the fluid, and read the biological status of your brain.
So what does this all mean for you listening? Like, why does spending 20 minutes diving into ancient Greek roots and Arabic mistranslations actually matter? It matters because medical terminology isn't some secret code meant to lock you out. It's a map.
Exactly, it's your map.
You might have a teenager going off to college who needs that meningitis vaccine, and now you understand exactly why that specific bacteria is so incredibly dangerous in a closed environment. You or a partner might receive an epidural during childbirth, and you'll know that the needle is navigating precisely upon the tough mother, the dura mater. Or you might be sitting in a sterile office, reading a loved one's radiology report, seeing the word meningioma, and realizing that a tumor of the protective membrane generally carrying a far better, more manageable outlook than a tumor invading the brain tissue itself. Knowing this vocabulary pulls back the curtain.
It really does.
It strips away the intimidation. It demystifies the human body and puts you firmly back in the driver's seat of your own healthcare.
And, beyond the practical applications, it leaves us with a really profound realization about the evolution of human knowledge. Think back to Rudolf Virchow. He named myelin purely because it visually resembled marrow under a basic glass lens in 1854.
Right.
He was completely unaware of its actual vital role as the electrical insulator for the entire nervous system. He named it for how it looked, not for what it did.
He was a brilliant scientist, but he was limited entirely by the tools of his era.
Exactly. So as we look toward the future of medicine, as we enter an era of artificial intelligence, advanced genetic sequencing, and nanotechnology, it raises a fascinating question for you to ponder.
Okay, let's hear it.
What parts of the human body are we fundamentally misnaming today? What structures or systems are we completely misunderstanding simply because we do not yet have the technological lens to see what they really do?
Wow. That is quite a thought. We started this conversation talking about the desire for X-ray vision, the expectation of clean binary lines when we receive a diagnosis. But the deeper we dive, the more we realize that even the words we use to map our own bodies are born from these murky waters and shifting perspectives. The diagnostic machine is incredibly powerful, but it is ultimately only as good as the language we use to describe what it finds.